Hello, everyone. This is my periodontology case study. Mr. A. Mr. A is a 26-year-old Hispanic patient. His only shift concern was that he wanted a cleaning. His social history: Mr. A is a single male who lives alone and works 5 days a week in a desk job company that he inherited from his father. He is currently attending college for his computer technology associate's degree. He tries to stay active and goes to the gym a few days a week whenever possible. He has said that he is stressing over school and work management. On the weekends, he likes to hang out with his friends and go for drinks. Dental history: Mr. A brushes 3 times daily, sometimes uses floss and mouth rinse. He has not been to the dentist in about 8 years. Patient has a history of occlusal composites fillings on his molar teeth number 18, 19, 31 occlusal buccal. He has existing sealants on teeth 3, 12, 14, 20, 21, 28, 29, and 30. As for his diet, he eats fast food at least 5 days a week, admits to drinking energy drinks and coffee to try to stay awake during his shift. He drinks alcohol at least 4 days a week. Medical history: Mr. A is 5 feet 8 inches. He weighs about 200 pounds. He has no medication, and his vital signs throughout his appointments were within normal limits. He is an ASA1 healthy patient. Patient assessment: extraorally, everything was within normal limits. Intraoral exam: I found melanin pigmentation on the lips and gingiva. Bilateral linea alba, 4 digranules on buccal mucosa, pericoronitis on 17 and 32, and coated tongue. As far as hard tissue, he had abrasion on lower and upper anterior teeth. He has a total of 32 teeth. He has a class 1 occlusion on both left and right side. His overbite and overjet are 3 millimeters. He has an even midline, and he has decay on teeth 1, 2, 4, 5, 15, 16, 18, 19, and 30. Gingival description: generalized slight marginal inflammation, localized moderate inflammation on lower anterior teeth. For his attached gingiva, generalized pink, localized red on lower anterior teeth and lower molar teeth. Generalized melanin pigmentation. For his interdental papilla, he has generalized pointed, localized bulgy on lower anterior teeth, and generalized bleeding on probing. For his periodontal summary, his probe readings were 1 to 3 millimeters generalized. He had 4 millimeters localized on his molars. He had 5 millimeters localized on 17, 18, and 31 and 32 due to plaque accumulation on 17 and 32 because he has pericoronitis on 17 and 32. He had 68 bleeding points. Plaque score: on his first visit, his plaque score was 54%. On his second visit, it went down to 30%. On his third visit, it went down to 24%. And on his fourth visit, it went slightly up to 35%. So, we had ups and downs. For intraoral photos, I took a photo of his smile, his upper arch, lower arch, left lateral occlusion, and right lateral occlusion. He has light wear on his upper and lower anterior teeth, and you can notice on that on his photos. For his I took more intraoral photos. I took intraoral photos of his pericoronitis on 17 and 32. He has a dark buccal shadow on number 19, which is decay. I took a picture of his lower anterior linguals because he had a lot of tartar buildup. I also took a picture of the buccal recurrent decay he has on number 18, a sealant with occlusal decay on number 30. Radiographs. I took bite wings. He has generalized slight bone loss, decay on teeth 4 mesial, 5 distal, 12 distal, which we put a watch on the 12 because it's very tiny. As far as the calculus, 18 mesial and 19 mesial and distal. Panoramic radiograph. On his panel, I saw hypercementosis in between teeth 30 and 31, close to the roots, and pericoronitis that can be seen on the radiograph. Dental hygiene diagnosis. Generalized periodontal case type 1 due to probing depths and bone loss, and calculus type 2. Treatment plan. For his treatment plan, on his risk assessment, patient brushes 3 times daily, occasionally uses floss and mouth rinse, frequent alcohol use, recurring decay and primary decay, eats fast food frequently, and drinks sugary drinks, especially energy drinks and coffee. He has slight bone loss, generalized, 68 bleeding points, and his plaque score on the last visit was still high. It was 35%. Implementation. For implementation, I put OHI, proper technique for brushing, emphasize the importance of brushing for 2 minutes, and flossing every day, as well as the use of mouth rinse. Nutritional counseling due to his caries, and regular cleaning, a D1110 hand scale, polish with a prophy angle and fine prophy paste with fluoride. Sodium fluoride varnish for preventive, and I put him on a 6-month recall. Prognosis. With treatment, prognosis is good. Patient will be able to control the disease with treatment and meticulous home care. I say it's good because it's been more than 8 years since he had a cleaning. So I think every 6 months will be he'll do good with the OHI, going over OHI. Without treatment, the prognosis is poor. Progression of disease will eventually lead to tooth loss. Caries could get bigger and cause pain. Referrals. General dentist to treat cavities. Oral surgeon for extraction of wisdom teeth, since he is accumulating a lot of plaque and he's having deep pockets in those areas, and they may probably cause more problems to the to teeth 18 and 31. And here are my references. Thank you.